Good afternoon. My name is Dr. Fredijan Amaratonol. I am a medical student from Bicol University College of Medicine. So today, I am here to conduct a neurological examination. So first, I would like to ask to you to please state your name.
Well, my name is Arapanda Anol, and good afternoon po.
Okay, so let's start this neurological examination by asking you first two questions. So, did you have any history of disease, like for example, stroke, paralysis?
No.
And second question is, did you have any problems with your coordination?
No.
How about your brain? Okay, so the next part of this neurological examination is what we call mini mental state examination. So I would like to test your orientation to time, place, and your surrounding or the environment. So first, I would like to ask, what is the year today?
It's 2020.
Okay, what month?
September.
Okay. Anong araw ba ngayon?
Sabado.
Sabado, so it's Saturday. Umaga ba ngayon or hapon?
Hapon po.
Okay, so hapon. So the next question is, I would like to ask, kung saan ka nakatira?
Well, I live in Tres Maria, Donso.
Action. So anong ginagawa natin ngayon?
You're conducting a neurological examination.
Okay, so, ayan. Sino ang paborito mong naging presidente ng Pilipinas?
Si Ramon Magsaysay po.
Okay, si President Ramon Magsaysay. So, are you aware who is our recent president?
Of course.
Okay, sino?
President Rodrigo Duterte po.
Okay. I would like you to count 100 downward. So, from 100, pababa. Okay? Sige, start from 100.
100, 99, 98, 97, 96, 95, 94, 93, 92, 91, 90, 89, 88.
Okay, that's enough. Okay, very good. So, can you spell the word world?
W-O-R.
Okay, so can you spell world backwards?
D-L-R-O-W.
Okay, very good. Okay, so can you name what is this object? What is this?
It's a watch.
Okay, so this is a watch. How about this? What is this?
It's a ring.
It's a ring. Okay, very good. Please repeat this phrase. No ifs and buts.
No ifs and buts.
Okay. So I have here a piece of paper. So what you're going to do is you will grab this piece of paper using your right hand, and then you will hold it in half, and then you will place it on the floor. Okay, so you got it? Okay, so here's the paper. Okay, very good. So I have here again a piece of paper, and I would like you to open this paper, okay, and read what is written in it and do it as it says. You got it? Okay. So can you show me what is written in the paper? Okay, so can you do it? Okay, that's good. Again, I have here a piece of paper, blank paper, and a marker, and I would like you to write a short sentence that contains a noun and a verb. Okay? Okay. Please write down. show me what you have written. Okay, so what does it say?
She cooks a spaghetti.
Okay, so what is the noun
She
and what is the verb?
cooks.
Very good. Okay. Again, I have here a piece of paper and a marker, and I would like you to draw two shapes that will intersect, and then it will create 10 angles.
Okay.
Okay, you get it?
Okay.
So you can start. Okay. So can you show it to me? Okay, so what did you draw?
I draw two pentagons with intersection.
Okay, so that intersects. And how many angles?
5 angles, each 2 objects.
Okay, so that is a total of 10
10 angles.
angles. Okay, very good. Okay, so let's move to the next part of this neurological examination. So, in this test, I would like you to rate from 0 to 4 accordingly. So, 0 is 4, not at all. 1 is 4, somewhat. 2 is 4, moderately. Okay, 3 is 4, a lot. And 4 is extremely. Okay, so let's start. So, do you feel sad or down in the dumps?
0.
Okay, so not at all. Okay. How about feeling unhappy or blue?
0.
0. Okay. Crying spells or tearfulness?
1.
1. Okay. Feeling discouraged?
0.
Okay. How about feeling hopeless?
1.
How about low self-esteem?
2.
Okay. How about feeling worthless or inadequate?
0.
So how about the guilt or shame?
1.
How about criticizing yourself or blaming others?
1.
Okay. How about difficulty making decisions?
0.
Okay. So in this area, I would like to ask activities and personal relationships. Okay, so loss of interest in family, friends, or colleagues.
0.
Okay, how about loneliness?
1.
How about spending less time with family or friends?
0.
How about loss of motivation?
1.
How about loss of interest in work or other activities?
0.
How about avoiding work or other activities?
0.
How about loss of pleasure or satisfaction in life?
1.
Okay. So we are now moving to physical examination. Okay. So do you feel tired?
Yes.
Okay. So you feel tired. How about what's the rate?
2.
2. Okay. So you feel tired. How about difficulty sleeping or sleeping too much?
2.
2. How about decreased or increased appetite?
2.
Loss of interest in sex?
1.
How about worrying about your health?
1.
Okay. So this next question is about suicidal urges. Okay. So questions is, do you have any suicidal thoughts?
0.
Okay. How about would you like to end your life?
0.
How about do you have a plan of harming yourself?
0.
Okay. So that is for Burns depression test. Okay. we are going to move to the next part of the neurological examination, wherein I would like to test your cranial nerves from cranial nerves number 1 up to 12. Okay, so we are going to move in the physical examination room, where I am going to conduct some tests. Okay, I would like to ask permission from you if I could touch you. Is it okay? Okay, because in the test we are going to do some sensory test, okay, and the motor test, of course. So we are now here in our physical examination room, and we are going to conduct a neurological assessment regarding your cranial nerves functioning. So now I am going to test your cranial nerves, and I would like to test first the cranial nerve number 1, which is the olfactory nerve. So the olfactory nerve is the one responsible for the sense of smell. Okay, so I have here a 2 piece of paper with a scent, and I would like you to recognize what is the scent of this.
Smells like a flower.
Okay, correct. How about this one?
Vanilla extract.
Yes, correct. That is vanilla. So let's move now to the second cranial nerve, which is the optic nerve. So I have here again a piece of paper, and I would like you to cover your right eye with this and then read the Snellen chart. Okay, so the Snellen chart is 20 feet away from you, and I would like to test your visual acuity. Okay, you understand? Okay, so please cover your right eye and read as I point with a laser.
E, T, F, G, T, E, O,
Let's move to a smaller one.
S, F, B, A, D.
A little smaller.
T, O, P, R,
Okay, let's move to the smallest.
X, I, T,
Okay, very good. Now let's move to the other eye. Please cover the other eye. Okay, let's start with the biggest one.
E,
Okay,
S, T, O, P, M,
a little smaller.
N, F, R,
A little smaller.
U, G, A,
Let's move to the smallest.
C, T,
Okay,
E, O,
so here's another test for the visual acuity. So here's a piece of paper. Okay, please cover your eye. Okay, and I would like you to answer this. Can you see this?
no,
How about this?
yes,
How about this?
yes,
How about this?
yes,
Okay. The other eye. Can you see this?
yes,
How about this?
yes,
How about this?
yes,
How about this?
no.
Okay, very good. So we are done with the cranial nerve number 2, and we are going to move now to the cranial nerve number 3, 4, and 6. Okay, so the 3 is for oculomotor. Okay, the 4 is for trochlear, and then the cranial nerve number 6 is for abducens. So these cranial nerves are responsible for the 6 cardinal gases. So here's a pen, and I would like you to follow this, okay, and say if you can see this. Okay, can you see this?
Yes,
Can you see this?
yes,
Can you see this?
Yes.
How about this?
Yes.
How about this?
Yes.
How about this?
Yes.
Okay, so you have a good cranial nerve number 3, 4, and 6 because you can do the 6 cardinal gazes. So here's another test. I would like you to look at this pen, the tip of the pen, and follow it as it moves forward to your nose. Okay? Okay, very good. Now I would like to test your pupils. Okay, so please cover this one. Okay. Okay, so your pupils are reacting to light and equally round. So we are now going to test the cranial nerve number 5. So this is the trigeminal nerve. Okay, so we have a sensory here and the motor. So for the sensory, I have here a cotton, and I would like you to close your eyes and then tell me if you feel this one.
Yes. 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 Yes.
Okay. Now we are now going to test. Okay, you can open now your eyes. Now we are now going to test, okay, the motor function of trigeminal nerves. So can you please smile? Can you please frown? Okay. Now can you show us your teeth? Okay. So now I would like to touch you. Can I? Okay. So can you please show us your teeth? Okay. So now I can feel the muscles here in this part. Okay, now we are going to test the cranial nerve number 7, or also known as the facial nerve. Okay, so I would like you to put your eyebrows up, down. Okay, can you smile? Frown. Can you please close your eye tightly, as tight as possible? Open it slowly. Okay, so you don't have any problems with the asymmetry of face, so you have a normal facial nerves. If ever there's a problem, it might be related to stroke, okay, which is called paralysis, or maybe related with Bell's palsy. So since your face is normal, there is no problem with your face asymmetry is normal, you have no problems with cranial nerve number 7. Okay. Okay, now let's move to cranial nerve number 8. So I would like to whisper, okay, some words or some sentence in your ear, and can you please repeat it?
Okay.
Okay, so I would like to, okay, come closer. Sleep well.
Sleep well.
The other one.
Good night.
Okay, so very good. You have a good acoustic nerve, or the vestibulocochlear nerve. Okay, so now we are going to test the cranial nerve number 9 and 10. Okay, which is glossopharyngeal nerve and the vagus nerve. Okay, so what I'd like you to do is to open your mouth and say ah.
Ah.
Say ah.
Ah.
Okay, so your uvula is moving up, okay, and your soft palate is also moving up. You can say that you have a good vagus nerve and glossopharyngeal nerve. Okay. We are now going to test your 11th cranial nerve, which is also known as the accessory nerve. So, can I touch you?
Okay.
Okay. Can you please move your head against this one? Against. Okay. Very good. Against. Okay. Can you please shrug up your shoulders? Shrug up. Okay. Okay, shrug down. Okay, very good. So we are now going to test your last cranial nerve, which is the cranial nerve number 12, which is also known as hypoglossal nerve. So what I would like you to do is to stick out your tongue. Okay. Open your mouth. Okay, so your tongue is in midline, so you have a good hypoglossal nerve. So we are now going to test your upper extremity muscles. So can you please put your fingers like hands like this? Okay, so for 10 seconds. Okay, I would like to count 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9. So now I would like to put my fingers in your hands, okay? And I want you to squeeze my fingers as much as you can. So now, okay, harder, harder, harder. Okay, very good. Okay, so I would like now to test your lower extremity muscles. Okay, so can you please put your right leg up? 1, 2, 3, 4, 5. Okay, the other one. 1, 2, 3, 4, 5. Okay, very good. So, can you push against this? Okay, let's push against this. Okay, very good. Okay, so we are now going to test your coordination. So can you please raise your right hand? Okay, so can you do this? 1, 2, 3, 4, up, back, and back. Okay, so do that. 1, 2, and back. Okay, as fast as you can. Do it as fast as you can. Okay, the other hands. Okay, very good. So, I would like you to touch your nose and then touch this finger. Okay? Okay, very good. So now I would like you to rub your left foot in your right shin. Do it vice versa. Okay, very good. So now we are going to conduct now a Romberg's test. So first I would like you to close your eyes. Okay, and I will count 1 to 20 and you should be able to maintain your balance. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, you can now open your eyes so you have a good sense of balance. Okay? Now what I would like you to do is to walk 4 steps away from me. Okay, so move 4 steps. Okay, so face me. So now I would like you to walk from there to here, okay, with your heels interchanging. Okay, okay, so I would like now to test your sensory. Okay, so I would like you to distinguish between sharp and then dull. Okay, so I would like you to close your eyes and say sharp or dull. Okay,
Sharp, dull, 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 sharp, sharp.
okay, very good. Okay, so now I would like to test your reflexes. So we are now going to start with your patellar reflex. Okay, so I would like now to test your patellar reflex. Okay, so so that sums up our neurological examination. So from the first part, which is the mini mental state examination, you actually passed. Okay, so you have a good neurological result according to the mini mental state examination. So in the second part of our neurological examination, which is the Burns depression test, okay, so it shows that you don't have any signs of suicidal urges. Okay, so you also have a good handling strategies or coping mechanism when it comes to stress, and you don't have any problems in relating to your significant others like your family and friends. So you have a good neurological result, okay, according to Burns depression test. In the next part, we have tested your cranial nerves. So you don't have any problems, okay, as I have seen, you don't have any problems with your cranial nerves. And then we also have tested your coordination, okay, which we done some tests, like for example the Romberg's test, which turns out to be normal in your case. Okay, so you have a good balance, sense of balance and coordination. Okay, so we also tested your sense of your sensory, okay, by differentiating which is sharp, which is dull. And also we have tested your reflexes. Okay, so one of that is the patellar reflex. So I would like to thank you for giving your time to me to conduct a neurological examination. So again, my name is Dr. Fredijan Amarantonol, a medical student from Bicol University College of Medicine. Nice meeting you, patient Ara Nol.